Well, thank you all. I'll report on today's action by the White House Coronavirus Task Force. The President and our entire team continue to be inspired by the way people all across this country are putting into practice 15 days to slow the spread. We are 10 days into the 15 days, and let me say again to every American, if you're in an area that's been impacted by the coronavirus, it's absolutely essential that you listen to state and local authorities for guidance. But for every American, what you can do is implement the practices outlined in the President's coronavirus guidelines today, because we truly do believe that, as millions of Americans have done and will continue to do, that we can significantly impact the rate of growth in this epidemic in our country. We can spare Americans from exposure to the coronavirus, and we can save lives. And so on behalf of the President and our entire task force, I want to say thank you to the American people. And thank you for your cooperation. Thank you for embracing the principles in 15 days to slow the spread. We heard about that cooperation today in a series of conference calls. We spoke with equipment manufacturers who are stepping forward as never before to assist us in developing the medical equipment that is essential, whether it be masks or other medical supplies or ventilators. FEMA reported to our task force today that hundreds of companies have stepped forward to be involved in the supply chain, and we are vetting nearly 70 of those countries for specific repurposing of their manufacturing to produce everything from masks to gloves to gowns and, of course, to ventilators. We also had a very productive call with Secretary Betsy DeVos with education leaders from around the country today. And let me say on behalf of the President and a grateful nation, thank you to all of our teachers, many of whom are now home, teaching children from afar, even in many cases while they have their own kids home from school. You are truly heroes, and the Department of Education, as well as your State Department of Education, are grateful to each and every one of you who find yourselves educating out of home. And the Department of Education has a helpful website on coronavirus recommendations, ed.gov/coronavirus. And as we mentioned before, Secretary Betsy DeVos and Secretary Sonny Perdue will be joining us at this podium on Friday to speak about distance learning recommendations that have been made not just for secondary or for college education, but also for K through 12 education. We're opening up avenues, creating new flexibility so that not only college students can continue to be involved in learning from afar, but children K through 12 can do the same. Secretary Perdue will also be here to talk about the food lunch program and free and reduced lunches. Today, the President and I also spoke to over 150 CEOs of the top nonprofit organizations in the country. We thanked them for their ongoing work, supplying the needs not only of people impacted by the coronavirus, but the most vulnerable among us in our communities. Organizations like Red Cross, the Salvation Army, Feeding America are all still working every day. And we promise to urge every American, if you have the means and have the ability, continue to be generous to nonprofit organizations that are helping those most in need in your community. The President marshaled a whole of government approach. That means working with our governors today. The President and I were in direct contact with governors of New York, California, Washington State, New Jersey, Michigan, and others. And we continue to be inspired and impressed by the leadership that governors are providing in their states, making tough choices, leading their states, and the President and I are truly grateful. The task force made a recommendation, and FEMA has assembled a team to provide technical assistance to the state of New York, and that team was welcomed by Governor Cuomo. Will be arriving on the ground there very soon, along with all the other resources that the President recently announced would be flowing to New York and to Washington State and to California. In my conversation with Governor Gavin Newsom of California, I was pleased to speak to him and hear that our FEMA team is literally at the table with the state of California's team working to meet their supply needs, working to work on capacity. And I want people to know in the states that are most impacted by the coronavirus that we are with you. We're going to stay with you. We're going to continue to work around the clock to make sure your courageous healthcare workers, your health systems, and your state governments have the resources to support your response. On the subject of testing, Dr. Birx will reflect on what the data is showing in just a moment. Not including local labs and hospitals, we are at 432,000 tests completed. And we're pleased to see that there are literally drive-through and community sites around the country, and the U.S. Public Health Service is assisting states in standing those up each and every day. We do remind hospitals and labs around the country, and the moment the President signs the bill, that it is absolutely essential that they provide the results of the test to us. It gives us visibility into what's happening on the ground. But because of the public-private partnership President Trump initiated with these vast commercial lab networks around the country, we are adding tens of thousands of tests every single day. On the subject of supplies, before the end of the week, we'll talk a bit more, as the President did moments ago, about the supply chain. I was at FEMA last night and literally saw a room full of people with laptops and cell phones. We are literally leaving no stone unturned, as I told governors today, to find medical supplies, whether it be masks or gowns or gloves or ventilators, and the team is working around the clock to meet those needs. A few smaller items. First and foremost, the CDC is developing guidance, which we'll be publishing tomorrow, about the best way to utilize our natural resources at our parks. It would be several weeks ago that our Park Service waived all entrance fees, and we directed the CDC to produce guidance for how people can still practice social distancing and common sense, but be out of doors and enjoy our natural parks. We'll also be sharing that guidance with the vast state park systems around the country and encouraging their support. With that, let me last say again, there's nothing more important for the American people to do to slow the spread than to heed your state and local guidance in areas impacted by the coronavirus, and for everyone else to put into practice the 15 days to slow the spread. Dr. Fauci will reflect on the importance of mitigation and the impact that we believe that it is having around the country. But it is, people ask me from time to time, what can I do? And I say from my heart to every American, this is what you can do. Not just to protect your own health and that of your family, but no American wants to inadvertently spread the coronavirus, particularly to those that may be vulnerable to serious health consequences. Remember that the risk of serious illness to the average American remains low. I mean, the vast majority of people that contract the coronavirus will have mild symptoms to flu-like symptoms and will recover. But for seniors with serious underlying health conditions or with people with immunodeficiencies, everyone needs to practice the principles of 15 days to slow the spread. The President announced this week that we are looking forward to the day that we can open up the country. And this team will be bringing him recommendations about how we can safely and responsibly do just that. But for every American that wants to see America back in business, you can hasten the day by putting into practice the 15 days to slow the spread. Go to coronavirus.gov for details. And I truly do believe if all of us will do all that we can do, we will slow the spread, we will protect the most vulnerable, and we will heal our land. With that, let me recognize Dr. Tony Fauci to speak about, Dr. Birx, please, and then Dr. Fauci. Thanks, Deb.
Thank you, Mr. Vice President, and thank you all for listening to us talk to the American people. We've been watching the testing results. It's very critical to us. It's very critical to be looking at that very carefully. Let me tell you two things that are going on in parallel. Our system to look at flu-like illnesses is still up and running in county after county and state after state. And why is that important? For those of you who've been following the flu epidemic this year, you'll remember we had flu A, then we had another peak of flu B, And those systems that are in every single state and local government is the platform where we can see whether there's any increase in flu-like illnesses. So if you have very few cases in your state and in your counties, maintain your flu surveillance system that you work closely with the CDC on, and look for changes in your slope of new flu-like illnesses. And there are enough test kits, and there's particularly enough of the CDC test kit where we started that runs on your flu surveillance platform to be constantly surveilling what those flu-like illnesses are in our states and counties that have very low number of cases. We have counties still with 0 to 1 cases, but they can participate in the surveillance that we need to have out there now by using their flu-like surveillance system, and we thank all of the states who have that up and running. If you go to cdc.gov and go to flu surveillance, you can see state by state, and you can be looking at those curves with us. It's what we're looking at day by day, in addition to the testing results that are coming in. For the testing results, still, there's 4 counties that constitute the majority of both the current cases and new cases. I think you know those are New York City, Westchester, New York, Suffolk, and Nassau County. Those are the 4 counties, all associated with New York and the New York metro area. There's a few counties in New Jersey, but this is still where 56% of the cases are and 56% of the new cases. It's very important that people look at the number of new cases per day. Remember, we told you it was going to take us a while to work through the testing backlog. I think we're close to working through the testing backlog so that you can interpret the number of cases per day, and you will see in New York City that the number of cases per day has been relatively constant over the last 3 days. Those are the number of new cases per day. This is a real call to every person in New York City and the New York metro area to continue every one of these 15 days to slow the spread, and to do that part of it at the same time that they're following the mayor's and governor's piece. Yesterday, we talked about people that may have left the metro area that were residents of the metro area that may have gone to secondary homes or other places to reside. And we've asked all of them to carefully monitor their temperatures and self-isolate from the communities where they went, just to ensure their own health and the health of their communities while people move around the country. Finally, why this is so important. It's very important to me personally because my grandmother, for 88 years, lived with the fact that she was the one at age 11 who brought home flu to her mother, named Leah, for which I am named, when her mother had just delivered. And her mother succumbed to the great 1918 flu. She never forgot that she was the child that was in school that innocently brought that flu home. This is why we keep saying to every American, you have a role to protect each and every person that you interact with. We have a role to protect one another. It's why we are social distancing and you are social distancing. But to every American out there, when you are protecting yourself, you're protecting others. And if you inadvertently, I know, brought this virus home to someone with a pre-existing condition, I can tell you my grandmother lived with that for 88 years. So this is what we're trying. This is the message that's important to everybody. This is not a theoretic. This is a reality. You can see the number of deaths that are occurring. We all have a role in preventing them. So thank you for the work that you do to get our message out to others, to really ensure that every American understands how important their role is as we move through these next 5 days, to not let up for an instant. I hear some reports that someone said, oh, well, the new cases in New York are increasing or the hospitalizations are increasing. The number of new cases over the last 3 days have been consistent, but not rising any more than a consistent day-over-day rise. You will see hospital cases continue to increase because they are a reflection of what happened 1 to 2 weeks ago before the full mitigation efforts were put into place. So each person in every place, no matter what county, what community, what state, can work with us to ensure that we prevent the spread of this virus to others. So thank you.
Thank you, Mr. Vice President. I just want to spend a couple of minutes telling you a little bit about some information that I got on our weekly call that we have at least once a week with the WHO, which is led by Dr. Tedros and Mike Ryan, who's the point man there, to give us some information. And in that regard, I want to apologize for my curt response to you when you asked me about the China deal, because I shouldn't have done that. That's not my style. But what I really wanted to say is that my job is that I'm a scientist, I'm a physician, and I'm a public health person, and I don't like to get involved in that stuff. So anyway, getting back to the WHO. So we learned some really interesting information because obviously the other countries like China and others had been hit prior than we did. One of the things that was striking to me, and I just throw it out because it's something that we will face. We're not facing it now, but we will face. Our Chinese colleagues are very concerned because they went through the entire cycle of the curve to come down. And they have very, very few cases. But what they're starting to see as they're relaxing the constraints on travel, that they're getting imported cases. And they wanted to warn us that when we get successful, make sure you very carefully examine how you're going to release the constraints on inputs. So I know we're going to be successful in putting this under control, but I think we're going to have to remember we don't want to import cases in. That's the first thing for today. The second thing that was important is that it was something that Dr. Birx mentioned, and that is when you look at the inflection of the curves, we now have multiple different countries that have gone through various phases of their individual outbreaks. And you could learn something from them about where you are in your own outbreak. For example, when China went up, what happened is they just didn't turn around. They went from going to, I'll just take an arbitrary number, 500 new cases a day. The next day it was 1,000 cases, then 1,500, and then 2,000. But once the number of new cases each day starts to flatten out, that's when you get to that point where the inflection goes down. So what things we want to look for, the things that Dr. Birx had mentioned. That doesn't mean you declare victory when it does that, but you know you're at least on the way to where you want to go. And I think that's really very important. The third and final thing that I think gets back to the question that many of you in the audience have asked of us is about, would this possibly become a seasonal cyclic thing? And I've always indicated to you that I think it very well might. And the reason I say that is that what we're starting to see now in the Southern Hemisphere, in Southern Africa, and in the Southern Hemisphere countries is that we're having cases that are appearing as they go into their winter season. And if, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. What does that mean for us and what we're doing? It totally emphasizes the need to do what we're doing in developing a vaccine, testing it quickly, and trying to get it ready so that we'll have a vaccine available for that next cycle. In addition, to do the randomized controlled trials of drugs so that we will have a menu of drugs that we have shown to be effective and shown to be safe. Because I know we'll be successful in putting this down now, but we really need to be prepared for another cycle. And what we're doing, I believe, will prepare us well. Thank you.
Thanks, Doc. We'll take a few questions, please.
Mr. Vice President, on ventilators, some really important reporting from the Center of Public Integrity today. They suggested that there's only 16,000 in the national stockpile. Can you just give us some clarity? How many ventilators do you have in the national stockpile? Who else is making them, and how long will it take for them to make a critical mass? Because based on the Center for Public Integrity, it appears there aren't enough if people are going to die as a result.
Ventilators has been a singular focus of a good portion of our supply chain stabilization task force at FEMA since the president stood up FEMA's National Response Center. And we're making progress in a variety of ways. First, there is the national stockpile, which you refer, and depending on what's been distributed, we just delivered 4,000 ventilators to New York, including ventilators that we sent to New York City. But there's that number of some 20,000, less than 20,000. I won't dispute your number. Beyond that, there literally are, by most estimates, more than 150,000 ventilators in the broad healthcare system all across the country. We also, working with anesthesiologists, and there was a very important conference call today, we have determined several weeks ago that the devices that anesthesiologists use for outpatient surgery can be converted with the change of a single vent to a very useful ventilator. I actually spoke to Governor Cuomo about that today. He's in the process of surveying all of his surgical centers, as governors around the country are doing. We literally believe there's tens of thousands of ventilators that can be converted now that the FDA has given guidance. And Dr. Birx can probably speak to that in a moment. We actually have produced a helpful video to explain how quickly those devices can be converted. But we're also working with General Motors and other companies to immediately spin up production. Those contracts are being reviewed. We're vetting their capability. But one of the other ideas is, as we look at areas of the country that are most impacted, and now more than half of the cases for coronavirus are in New York State and in the region around there. But we'll want to focus our resources, including ventilators, on where communities are struggling the most with coronavirus. And so one of the ways that we're working through that at FEMA now is by spinning up production and at the same time working with the existing national supply, maybe from areas that don't have a particular burden yet with the coronavirus, and making sure that we're manufacturing, backfilling, and meeting that need. But what I can tell you is we've got an extraordinary team. Admiral Polovchek is a two-star Navy admiral who's doing an incredible job. We literally are identifying resources around the country and around the world. We're contracting and arranging transportation for those. But maybe Dr. Birx, you can speak to the ventilator, particularly the transition.
Thank you, sir. So I just want to thank Dr. Mary Peterson and the whole team of the American Association of Anesthesiologists, because they immediately, when we asked them, could these be modified, they went to immediate work on it. They're going to have Q&As up but more importantly, every anesthesiologist in every city has been working with their state and local health officials to really work with them how to change this. And I think that's not only the ventilators that they'll be supplying, they have the people that run those ventilators that are not any longer doing elective surgery. So changing that elective surgery piece over a week ago has freed up a lot of additional resources. When I talk to you about how we've done some things that are very horizontal across the country, but we're collecting data now in a county by county granular way. So it's like any epidemic, it's not equal everywhere. There are places that are very spared, and there's places where there's more. We have a very vast country with a lot of capacity and a lot of infrastructure. And so looking very specifically about where the virus has been, where is it going, who's got freed up resources from where it has been, because it didn't hit it hit Washington State earlier than it hit New York, and looking at all of those pieces to really ensure how we can innovatively move equipment around based on the need. And so I know that it has become a place where people are looking at numbers rather than what is needed. Because if you do these projections, when you got to those projections that said, like in Germany and others, that implied that 60% or 50% of the population would get infected, I want to be very clear, the only way that happens is this virus remains continuously moving through populations in this cycle, in the fall cycle, and another cycle. So that's through 3 cycles with nothing being done. And so we're dealing with cycle A right now, not the one that could come in the fall of 2020, although we're getting prepared for it by the innovations that are being worked on, and not the 2021. We're really dealing with the here and now while we're planning for the future. And I think the numbers that have been put out there are actually very frightening to people. But I can tell you, if you go back and look at Wuhan and Hubei and all of these provinces, when they talk about 60,000 people being infected, even if you said, oh, right, well, there's asymptomatics and all of that, so you get to 600,000 people out of 80 million. That is nowhere close to the numbers that you see people putting out there. I think it has frightened the American people. I think on a model that you just run full out, you can get to those numbers if you have zero controls and you do nothing. And we know that every American is doing something. And so I think what our job right now is to carefully detail on a hospital by hospital, state by state, county by county, to outline what the infrastructure needs are and ensure that we're meeting them, both from the stockpile and from the generosity and movement of the American people and other hospitals.
Dr. Birx, a lot of folks out there, well-intentioned, are sewing cloth masks and donating them to hospitals. You or Dr. Fauci, can you weigh in on that? Because obviously these people have great intentions, but there's some mixed feedback on whether that's a good idea.
I'm sorry.
Better than
what-
nothing? Lots of surgical masks. People are sewing them. So clothing manufacturers, volunteers dropping them off at hospitals. Is that necessary? Is that helpful? Is it something you'd recommend?
Well, I
Better than
mean,
nothing?
you would only recommend that under desperate situations if you don't have any mask. But what we're seeing now, as you've heard, is a rather significant inflow of masks that are coming in that are going to be available. I mean, obviously, if you don't have a mask and you need a mask and it's appropriate for you to be wear it, you do what you can. But I don't see that now as a necessity, given what's going on right now.
Great. Great.
Mr. Vice President?
We'll take a couple more, thanks. Go ahead.
Thank you, Mr. Vice President. We keep hearing reports of competition among the states that are trying to buy this necessary equipment on the private market. And the governor of Kentucky said yesterday that his state was in line to buy some equipment, but FEMA came in and purchased it from under them. So he says this is creating a real problem for the states because on the one hand, they're being told to get the equipment themselves if they can, but on the other hand, the federal government is buying up the supply chain. So is this a problem that you're hearing about, and what is your advice to states like Kentucky that are having this issue?
I actually spoke to the governor of Michigan today, Governor Whitmer and I, about just that. And we put our FEMA regional representative right on the case. We want to make sure that we're acquiring every bit as much as we can through FEMA. But as we work with the supply chain, we want to have full coordination with the states and the requests they're making and hospitals that they're making. And we're looking into those matters. But make no mistake about it, this FEMA team at the President's direction is leaning into this effort, leaving no stone unturned, literally searching not just the nation but the world for all these critical supplies. And as the President just reported to you, we're in the process of shipping 9.4 million N95 respirators, 20 million surgical masks, 3.1 million face shields, and the list goes on. And we're going to be shipping those every single day. But as I told Governor Whitmer today, who's leading her state through all of this with great energy, we want to partner with her. We want to partner with every governor and make sure that the left hand knows what the right hand is doing in terms of acquiring resources.
Mr. Vice President, thank you, sir.
Or how about you right here?
Thank you so much.
No, right here.
Thank you. Can I ask the
Thank you.
next one?
Go ahead.
On the mask question, healthcare workers on the ground still report that there are mask shortages. What timeline do you predict for making sure everyone who needs a mask is adequately supplied?
Well, I'm going to let Dr. Birx address that as well, but let me say again, I just received a report. We're going to be detailing it before the end of the week, where we've literally identified significant resources, not just around the country but around the world, of the masks that can be used by healthcare workers. And but as Dr. Birx said, we are focusing those resources in the areas where healthcare workers are most exposed to the prospect of contracting the coronavirus. The President's made it clear from early on, right after seeing the needs of Americans who are struggling with the coronavirus, making sure they have the support that they need on the same level of priority. We want our healthcare workers to have the personal protective equipment to be able to do their job safely, and we're working on that. I will tell you, I spoke about this today to several governors, not only the governor of Michigan, but the governor of Indiana, and President Trump and I couldn't be more grateful. The way governors around the country are joining us in calling on businesses to go back to their warehouses and identify industrial masks, N95 masks, that because of the change that President Trump insisted on in the law, can now be used by hospital workers. And they're perfectly acceptable to protect a healthcare worker from the possibility of a respiratory disease. But we're calling on, and our governors are joining us in calling on every business across America during this time of great challenge where many businesses are idled. Go back to your storehouses, identify N95 industrial masks, and as I told our governors today, they can call FEMA, they can call the state healthcare services, or they can just load them up on a flatbed and drive them over to their local hospital. And literally, we hear stories in every state in the union of people doing that. And so it's happening all at the same time. And we'll be detailing the progress we're making on masks. Anything further, Deb?
Thank you, Mr. Vice President. I just wanted to add one piece, and this is really a call to every state out there and every county that has been doing community-based testing. The FDA put out new guidance, we talked about it several days ago, that people can do self-testing in the drive-through, where you give them the materials to do it in their car, and you pick it up in a biohazard bag. This would free up all of that PPE that you see being utilized in those drive-throughs back to the hospitals and back to the clinics that need it the most. We have to move to the new technology. FDA worked tirelessly to get that out there so that it could be sparing of gowns and gloves and full respiratory N95s. This is the moment to move to that self-testing front of nose with the new applicators that can be utilized so that every single bit of the N95s can be put into the hospitals that need it.
Dr. Birx?
Mr. Vice
Dr. Vice President?
Last question.
Let me just say we look forward to seeing you all tomorrow. We'll be back here with further progress and news. But if I could just say to every American,
Is he okay? He keeps asking
we'll
you.
get through this.
He keeps asking you if you're okay.
We'll get through this. But we'll get through this together. Every American needs to understand that whether you are in an area that's impacted by the coronavirus or an area where there's very few cases, if you do your part to put into practice 15 days to slow the spread, you will do just that. You'll impact the spread of this coronavirus epidemic in our country. These experts tell me that we can significantly reduce the number of Americans that would be exposed to the coronavirus as every American continues to put these guidelines into practice. And we just know that with all of the extraordinary effort that's being done at the federal level by this tremendous team and all of our agencies, all the great leadership by governors in both parties across the country, with all the incredible and courageous work by healthcare workers, with the cooperation and the prayers of the American people, we will get this done. We will not only slow the spread, we'll protect the vulnerable, and we'll heal our land. Thank you all. We'll see you tomorrow.
Question on the